hear about women and the risk of bone degeneration. But according to data from the National Osteoporosis Foundation, the disease affects approximately 2 million American men as well. But often the disease goes unreported in men because few recognize the symptoms. And joining us this morning to talk more about osteoporosis is Dr. Kyla Lee. Good morning, doctor.
Good morning, Stacy.
First off,
you were right. 12 million men are at risk too. So this is very important.
And how many men are affected versus women? Like how many more?
2 million American men, as you say, have this, but 12 million are at risk. So men who take steroids or seizure medicine or have a history of chemotherapy or maybe lower sex hormones as they age, people who have excessive alcohol, are smokers, those are the men at risk that we have to really reach.
And what are some of the signs and symptoms that they may have?
Well, osteoporosis, as with women, is fairly silent. They may notice that their height is shrinking or something like that. But I just had a 50-year-old in clinic, and he was active, trying to keep up with his teenagers, running, but felt fatigued, and then wanted to talk to me about Viagra and some erectile dysfunction. And we checked his testosterone, and that was low, and then checked a bone density test on him, and that was low. And just by replacing his testosterone to the right levels, we were able to help his bones.
Are there other health problems that can lead to osteoporosis?
Absolutely. This is a great question. So chronic diseases with the kidneys or lung, and then like asthma, rheumatoid arthritis with the medicines that they need to take with steroids in that certainly put you at higher risk. But for everybody needing to supplement with calcium about 1,000 milligrams a day, worrying about your vitamin D levels, especially here in the wintertime, needing 800 to 1,000 milligrams a day. And then the weight-bearing exercises, backing off on the cigarettes and the alcohol, important lifestyle changes.
And not only should men follow these, should women follow some of those health tips as well?
Absolutely. And both men and women need to have their vitamin D levels checked at their doctor. And then men, especially if they're feeling more fatigued or noticing problems, should have testosterone checked. If that's low, they need a bone density.
And should they be at any certain age to get this done?
Well, we think earlier on in life, as bones are building, they're stronger. But just as women, as you get older, these things matter. So when you hit the disease process or you notice the fatigue, more of those things, then we start screening men probably after 50 if they're having problems.
All right, doctor. Well, thank you very much for joining us this morning.
Thank you, Stacy.